funded HRA is essentially the same thing as a regular HRA that you know today. However, it's funded, instead of being funded by the employer when a participant has claims, it's funded in a trust. So there's money that's held in trust, protected for the benefit of those participants and have that account. That participant actually then can control that money that's held in trust and invest it just like they do their retirement plans. The reason they should care is because it becomes a functional part of their successful retirement planning. Every single one of us is going to have Medicare Part B, Medicare Part D, non-insured expenses during retirement. The question really becomes not whether or not we're going to have those expenses, it's how we're actually going to fund it. How are we actually going to pay for those expenses into retirement? And really what the Funded HRA does is it gives them a triple tax-free mechanism, a way to pay for those expenses so they don't have to spend their Gulf money, their retirement money, on health care. The contributions going into the Funded HRA are without tax. The earnings on the invested assets while the money's there are without tax. And the distributions for claim reimbursements and premium payments during retirement are also without taxation. There's never any tax. What they do then is they take this structure and they can build all kinds of healthcare cost management strategies with the Funded HRA. So the idea of having this trust that funds that HRA, those two pieces put together, gives them a vehicle that they've never had access to before. They can tie it to a higher deductible health plan election to control their healthcare spend for their active employees. They then also could set up retiree accounts. So essentially a retiree funded HRA would allow that employer then to put monies into the account all during the working years, but it wouldn't allow them to reimburse for claim reimbursements until they get into the retirement years. So it allows the employer to build not only active healthcare cost management strategies, but also retiree strategies that dovetail very, very nicely with all the retirement plans that they sponsor for their employees. One of the concepts that we really liked was the idea of consumer-driven or consumer-directed healthcare plans. The idea of buying less insurance by increasing the deductible and then giving somebody an account that basically reimbursed them for their deductible expenses at a certain level, even 100% of the deductible as an example to keep everybody comfortable. Like the idea of reconnecting the consumer with the true cost of care, and this was a mechanism to actually re-engage that consumer with healthcare purchasing and healthcare spend. So we thought that was cool. What gets me excited about the benefit space in general, in particular the Funded HRA, is that every single person you know, including yourself, has a need for one of these. Everybody does. We actually have a case study that we did on one of our very first customers. It was a 1,500 life school district in the Minneapolis metro market. Well, 5 years into the program, 73% of those teachers were in the high deductible plan by choice, okay, and 70% of those participants had account balances in their Funded HRAs greater than their total out-of-pocket that they would have had to spend for their health plan.